What do you have for us today, Jazz?
Well, today we're talking about women. Women and exercise.
Women and exercise. Okay. What about women and exercise?
Well, so there's only so much I can say. There are way more studies that have been done on men and fitness than have ever been done on women. And so we do generally just know a lot more about how exercise affects men. And does that really surprise anyone? I'm not sure.
But doesn't that, you're doing exercise experiments on human beings.
Yeah.
What does it matter whether they're men or women? Like, doesn't the human body respond to exercise the same, regardless of whether you're male or female or anything else?
Right. I think that was the hope of the people conducting these trials, but it turns out that men and women actually have a lot of differences, especially when it comes to how they respond to exercise.
And science hasn't studied those differences very much, it sounds like.
Unfortunately, women have kind of been left in the dust, but we do know a few things, especially about when it comes to trying to lose weight.
Okay, tell us about that.
That's a big issue. When women are trying to lose weight and they eat less calories than they're burning because they're working out, they end up losing more muscle mass than men, but less body fat and just less weight in general than men.
Oh, that sounds so unfair.
That is just like the opposite of what you're going for when you're trying to lose weight, in my opinion, at least.
It sounds unjust.
It is. Women are used to that, though.
Okay, so what are the other differences?
Estrogen affects things big time, too. So, especially where you store your fat, which is harder to lose in the first place. That's why women tend to store more fat in our hips and our thighs and our glutes or your butt, while men store more fat around their middles, their tummies.
Okay. And what does this mean? Does this mean anything to...
No. Yeah, of course it does. It has big implications for exercise and how we should be approaching our workouts. Today, our guest host and our guest are going to talk through what we do know about how women respond to exercise and what that can mean for you female listeners out there. The idea is so that we can start to better cater our workouts to our physiological needs as women.
Okay, welcome to episode 105 of Eat, Move, Think. I'm Christopher Shulgin.
I'm Jasmine Ratch.
So who do we have on the show today?
Our guest today is Professor Michaela Devries-Aboud. She's an exercise physiologist at the University of Waterloo, and she spent her whole career researching these sex differences in the way women respond to exercise relative to the way that men do.
Today, she's in conversation with Dr. Andrew Miners, Medcan's Clinical and Product Director of Sports Medicine, Therapy, Rehabilitation, and Fitness.
Yes, now let's hand it over to Dr. Andrew Miners.
Welcome to Eat, Move, Think. I'm Dr. Andrew Miners, and I'm super excited to welcome you, Professor Michaela Devries-Aboud. We're going to be talking about exercise and women and sex differences and how we approach exercise and how women might respond to exercise differently than men. So, Michaela, what do we know about how men and women respond to exercise? Like, is there a difference? I know historically, basically, women have been treated the same, but that's not true?
Yeah, the issue is that compared with research done in men, women have been vastly understudied. And so as a result, we know much less about how women respond to exercise and whether men and women respond in the same way.
Okay, so just how understudied are women in research?
Well, yeah. So Dr. Jen Jacoby and I, and she's a prof at UBC Okanagan, we did a retrospective analysis of papers that had been published in Applied Physiology, Nutrition, and Metabolism since its inception. It started out as the Canadian Journal of Applied Physiology. And so what we did is we looked at all the studies that had been published since it had started to publish papers. And of all the papers that were published, 35% of papers included men only. And only 10% of papers included women only. So an additional 35% of papers included both sexes, but only 10% of papers where men and women were both included, only 10% of the total papers that were published included sex as a bivariate measurement.
Like teased out the difference if there was a difference.
Yes, and looked to see whether or not the males and females responded in a same way to that intervention. Every other study essentially just lumped the males and females together and assumed that the response would be the same and that, it didn't matter that there were males and females in the groups. They're just going to respond the same. And interestingly, 15% of papers didn't even say what sex of people they used.
Just said they were people.
Yeah, just said humans.
Because that would have potentially skewed the results in both directions, because women might have responded differently and men might have responded differently. So it might have blunted the outcome of those research studies depending on what they were looking at.
Exactly. And so all of a sudden we've said, hey, we're not going to do this. It doesn't work. But meanwhile, it worked in one sex and not the other. And as a result, we completely missed the results.
That's interesting. You see that in other research when they look at, a lot of times research is done on young population, males or females, but the university age crowd, because there's lots of subjects where the research is being done. And then we're trying to extrapolate that to either older people or children. And we miss the boat on that too. It's interesting to know that that happens with males versus females.
Absolutely. Yeah.
Wow.
So as a result of that, we essentially don't know whether or not women are going to respond in the same way to these diet and exercise interventions that we've been telling people are going to improve their health.
Which leads to frustrated people, especially if it's the wrong recommendation at the wrong time for the wrong person.
So we need a lot more research to be done in women, and we need to compare the sexes.
Very exciting. That's what we need to do.
Yeah.
When we talk about sex differences, we usually talk about at birth, male versus female in terms of the anatomy and structure. But that can be sometimes different than gender. And if someone is gender non-binary or if someone is doing gender transition, we talked about the lack of research just looking at the sex female. Is there any research on people that are going through those changes or that are gender non-binary or are transitioning? Is there any research at all on how they might respond differently or the same to exercise or other recommendations?
Yeah. So there's really if we think that there's not a lot in females, there's even less that's been done on non-binary populations or individuals who have transitioned from one gender to the other. And essentially, the only work that has been done was some work done in Amsterdam back in the early 2000s. And there's been a little bit, but it predominantly has to do with just assessing sort of what changes in response to that changing hormonal milieu. And really nothing has been done looking at the effects of different nutrition or exercise regimes in these populations of individuals. And so I think that's an area where there will be research in the future because we do have an agency within the Canadian Institutes for Health Research that's focus is on sex and gender work in order to ensure that we're optimizing the health of all Canadians.
That's exciting to note. Exercise is frontline therapy for almost everything. Why is it that, women have been left out or just squished in with the men over time? Like, why is that? Is that patriarchy in medical research? Or why is that?
Historically, it was because of the fact that women have an unstable hormonal milieu, meaning that because we have a menstrual cycle, our hormones are going up and down throughout the menstrual cycle. And when we do physiological research, we want to keep everything except for the intervention as consistent as possible, right?
Sure.
So then all of a sudden, you've got these women whose hormones are going up and down across the menstrual cycle, and you don't know how they're going to influence your intervention and your outcomes. And so as a result, women were just excluded from research because they could do the intervention in men, and men had a very stable hormonal milieu. And, they assumed that women would respond in the exact same way that men would.
Right.
However, it's now being realized that essentially because of those fluctuating hormones, women may not respond in the same way to a given intervention as men do.
Right.
So as a result, now there's, pressure and rightfully so on researchers to ensure that we conduct research in both males and females. However, that gets really, really expensive and research is already expensive. And all of a sudden you're having to do your trial and you're having to do it in both males and females, and it's doubling your budget. And, there's only so much grant money that we can apply for, and there's only so much that we receive. And as a result, oftentimes people will say, it's a proof of concept. So we're going to try it in the males first. And if it works, we'll try it in the females. But something that may not work in the males might actually work in the females. And so, it's kind of a big catch-22 at the moment. And hopefully it's something that's changing for the better going forward.
That's really interesting. So, it sounds like what you're saying is men and women aren't the same. We know that they're not the same.
Right.
But they've been considered the same in a lot of exercise prescription, a lot of exercise research.
Yeah.
There's specifics in health and medicine that link just to female care.
Yeah.
Not just human care per se.
Absolutely. I've done some work in women, postmenopausal women, looking at their ability to take protein
Hmm.
and turn on their muscle protein synthetic response. And the reason that we were doing that work is there had been some work from Bettina Mittendorfer's lab, and she's out in the US, but she had looked at the ability of protein to increase muscle protein synthesis in older men and women. They were giving them just a supplement,
Hmm.
and then they measured the amount of protein their muscle made over about a 4-hour period of time. And so the older women
Hmm.
that were postmenopausal had higher rates of muscle protein synthesis. They were better able to sort of make muscle protein than the older males were. But in response to feeding, the women couldn't increase muscle protein synthesis at all, whereas the men increased it, but not as much as what would have been seen if when they were younger, essentially. So the ability of protein to increase muscle protein synthesis is blunted in the older males compared to younger males, but it's even further blunted in the older females. And so then that could have implications for sort of development of sarcopenia and sort of those frailty associated conditions. The response to protein feeding is very similar in young males and females. It's
Hmm.
the older women that it may not be as effective. And so then,
Okay.
because sort of once women hit menopause, they have an accelerated loss of muscle mass due to the loss of estrogen.
Hmm. Hmm.
Essentially, the nutritional strategies in order to optimize and prevent loss of muscle mass may be a little different for the older women compared to the older men.
Interesting. And one of the things that is used for training, particularly endurance training, is carbo loading.
Yes.
So eating, having a spaghetti dinner before the weekend half marathon or something like that. We talked a bit about protein in women. What about carbo loading? Using that as a tool.
Yes. So there's been a few studies that have come out showing that women do not respond to carbohydrate loading like men do.
And why is that?
So it's interesting because it has to do with the absolute amount of carbohydrate that has to be consumed.
Hmm.
So, generally speaking, in order for people to carbohydrate load, they need to consume at least 8 grams per kilogram body weight per day during that loading period.
Okay.
And so men do that very easily by consuming about 75% of their energy intake from carbohydrates.
Okay.
Women, in order for them to consume that amount of carbohydrate, would either have to consume all of their energy for that given day from carbs.
Like 100% carbohydrate.
Yeah, which you can't do. Or they'd have to increase their energy intake by about 30%.
Hmm.
And so if you're doing that over the days leading up to a marathon,
Mm-hmm.
all of a sudden you're carrying more weight around with you, right?
Mm-hmm. Absolutely. You'd be running with a full belly too.
Yeah. So essentially, if women simply consume 75% of energy intake from carbohydrates, they actually don't increase their muscle glycogen stores at all.
Interesting.
In order for them to increase muscle glycogen stores, they had to increase their energy intake in order to reach that 8 gram per kilogram body weight plateau.
So it wouldn't be recommended to do high carbohydrate loading in advance of an exercise, or would it still be applicable for women? It's just done in a different way, or really not necessary. Just eat your regular meals as opposed to focusing on 1.5 pounds of spaghetti.
So I guess it would all depend on the sport, right? So anything where you're carrying your weight, it's
Mhm.
probably not going to help you out
Gotcha.
because it's going to be so difficult for you to carbohydrate load, and it's going to involve you taking in a caloric surplus in the days leading up to your event, right? And so then that's not going to give you a performance advantage, even though you have more muscle glycogen on board. For sports where it's, I guess, more related to, how much fuel you have on board, but your body weight doesn't really matter. There may be some advantage, but again, it is really difficult. It's going to be difficult for the female to
Mhm.
achieve this.
Gotcha.
My guess is there may be better strategies for women to use. We just haven't really figured them out yet.
So that's really interesting because we don't have a lot, and you're one of the leading researchers in Canada looking at these differences. So on the research that has been done, is there some key points or areas where there's a distinct difference between how men versus women would respond to certain types of exercises, like either resistance training or high intensity interval training? Or what are the key things that might be top of mind saying, hey, here's the difference between men and women and exercise that we want to know about?
Yeah, so there's been research that's been done, obviously looking at the effects of exercise on insulin sensitivity.
Okay.
And we know that exercise is good to improve insulin sensitivity. We know that exercise is protective against the development of insulin resistance and type 2 diabetes in women. Like the Nurses' Health Study has shown that very, very clearly. But in intervention trials where they've compared the effects of training between males and females on insulin sensitivity and indices of glucose control, that effect seems to be blunted in the women compared with the men. So there's been a lot of work in this area with sprint interval training, for example.
Okay.
And we know that sprint interval training is a great modality to improve insulin sensitivity. We've seen the data. But in the females, in all of the trials involving females, the females don't improve to the same extent as the males, or they don't improve at all.
Really? Not at all.
And so that's a really key example there of a different effect. And I mean, in my PhD, one of the trials that I did was a training trial, 12-week training trial in overweight and obese women. And these women were sedentary at the outset, and they worked their butts off in this training trial, and they had huge improvements in other outcomes. So their blood pressure went down, their blood lipids improved, their waist circumference went down, their aerobic capacity increased, their insulin sensitivity, no change whatsoever.
Let's say that we have a female who wants to train, become more healthy, and is, borderline type 2 diabetic, or is a type 2 diabetic. What recommendations then would you make for that person to help to improve insulin sensitivity?
Yeah, so we're not saying exercise doesn't work. We know it does. We just don't know why women are either taking longer to respond or they're not responding as readily. We just don't know yet. And part of that might be because women are inherently more insulin sensitive than men to begin with. So we know that women are protected against the development of type 2 diabetes up until menopause. And so it could be that because women are more insulin sensitive to begin with, they don't have as much room to improve as the men do with training. The other hypothesis, again, has to do with this whole estrogen thing. Estrogen is protective against the development of type 2 diabetes, in part because it can act as an antioxidant within the body. And the important thing to recognize is that with exercise, we get an acute increase in reactive oxygen species. And
those are considered bad things typically.
Yes. And if they're elevated all the time, absolutely, it is bad. It's associated with increased risk of disease, including type 2 diabetes, which is one of the reasons why estrogen is thought to be protective. If women, when they're exercising, particularly with sprint interval training and high intensity interval training, if they're not getting that increase in reactive oxygen species that's being produced during the exercise bout and acts as an important signaling molecule to induce adaptations, then that might be why we're not seeing the improvement in insulin sensitivity. And a key thing here is the fact that oxidative stress produced during sprint interval training and high intensity interval training is one of the key mediators to the improvement in insulin sensitivity. And so that could be another reason why women aren't responding as well.
Interesting.
Which would mean that the response, it's obviously not going to get completely rid of the oxidative stress or the reactive oxygen species. And so to me, that suggests more so that it's just going to take women a little bit longer to get to those effects and have that benefit of exercise. But again, the key point is, if you think back to my trial that I had, those women, while their insulin sensitivity didn't improve, so many other aspects of health did.
Yeah. And so it sounds like we're really talking about differences in metabolism and how,
Yes.
how our body works kind of at the cellular level.
Yes.
And are there any other differences in male-female metabolism that might be related to hormonal fluctuations or just general differences between men and women that have an impact on how we respond or how we wouldn't respond to exercise?
It all comes down to estrogen. And so estrogen has an impact on how our body stores and utilizes fuel.
Okay.
So if we think of males and females, and we think about the way males store fat. So males typically store fat more so around the middle, and women store their fat around the hips and glutes area.
That's the classic apple pear morphology we talk about. Right?
Exactly. And then as soon as women hit menopause and the estrogen levels decline, you can see that the fat storage shifts more to that middle and that apple
Hmm.
shape as well, right? And so that is one of the reasons why we know that this is an estrogen mediated effect. But generally speaking, as a result of the fact that men are storing more fat around the middle and women are storing more fat around the hips and thighs, men actually also store more fat within their liver.
Hmm.
And this is one of the reasons why men have a greater risk for non alcoholic fatty liver disease than women do. And we know that's mediated by estrogen as well, because in animal trials where they take female rodents and they remove their ovaries,
Hmm.
they see huge increase in hepatic or liver fat stores after that surgery is completed and estrogen has been removed.
More like the men or the boy mice.
Exactly. And then when they start to give the female rodents estrogen again, that hepatic fat decreases. And so they get a reduction and the amount of triglycerides stored in the liver goes back to normal levels.
Hmm.
And so we have a pretty clear understanding that estrogen is mediating that. Estrogen's also mediating how women store fat within the muscle. And so women actually store more fat within their muscle than men do.
A lot of times people don't think of having fat in muscle.
Yeah.
And, with disuse atrophy, you see fatty infiltration in the muscles. In my line of work, we see that in low back pain when looking at research when people have been injured and they become less active, you get fatty infiltration in the muscle tissue. Is that what we're talking about? Do people store fat in muscle?
Yeah. So in the lean sedentary person, about 1% of muscle is muscle triglycerides or intramuscular triglycerides. And so it's not a huge storage,
Hmm.
but it's an important fuel source for exercise. And so essentially you have lipid.
Okay, so it's fuel. Sounds bad, fat in my muscle, but it's fuel. Okay.
Yes, but it can be bad. And so about 20 years ago, it was discovered that lean sedentary people had about 1% of their muscle was these IMTGs or intramuscular triglycerides.
Hmm.
And then if you looked at obese individuals, they had more, and type 2 diabetics had even more. And if they correlated the lipid content with insulin resistance, it was directly correlated. And so people were really excited because they thought they had found sort of the mechanism of peripheral insulin resistance.
Hmm.
Then they looked at athletes, and athletes actually also stored a higher amount of triglycerides within their muscle, which makes sense because they need more fuel.
Because it's an energy source. Okay.
Yeah. So coincidentally, women store more triglycerides in their muscle than the males do, which would suggest that maybe they're at a greater risk of type 2 diabetes. But they're not, because work that we've done has looked at how women store these triglycerides compared with males. And women store their triglyceride as more numerous lipid droplets, and it's large lipid droplets that have been found to be associated with insulin resistance.
Hmm.
So we've learned a lot in that regard. It's not the total amount of triglyceride within the muscle, it's how it's stored and it's the lipid droplet size.
Why do we think there is that difference between sex, males, females, and how lipids are being utilized or even stored or how they're being stored?
That's a great question. I guess, I mean, if I think back to, and this is going back way back in time, really playing on the gender roles, the males needed to have fuel on board that would allow them to chase prey
Hmm.
and escape prey. And our carbohydrates are our high energy fuels. Whereas females were more so gathering,
Hmm.
and females obviously needed to be more protected to survive, essentially, because the females are the ones that are going to carry the next generation. And so for them to store more fat would be protective.
Hmm.
And just the mode of exercise that they would have been doing, they don't need to be sort of sprinting, I guess. They're more so moving at a lower intensity. And so they can sustain their activities by using fat during that exercise bout.
Interesting. We talk about slow twitch fibers, fast twitch fibers, mixed fibers. Is there a sex difference between that as well?
Yeah, so it's interesting because some studies have found that females have a greater amount of type 1 muscle fibers than males, which are the slow ones. Other studies have found no difference. And so I think there's a meta analysis in my future that kind of really starts to analyze this, because you have to remember a lot of these studies, because we're taking muscle samples, and, as I talked about the fact that budgets are are constrained and
Mhm.
we're trying to do as much as we can with limited amount of funds, a lot of these studies have a small sample size.
Right.
And so a meta-analysis would allow us to tease out slight differences that statistically we weren't able to observe in the individual trials.
Interesting. And just for our listeners, a meta-analysis is when we take the results of multiple studies and mash them together to make a big study kind of idea, right? Or not the results, but more the data from multiple studies and put them together to have a better insight into what's actually happening. If female listeners, women listening in on our podcast here, if you were going to say, here's 3 things to take away, what would we take away from, if that's even possible to say, here's the 3 things we need to know about how women need to think about this when exercising? Or do we need to do that?
So the main thing I want to point out is that in a lot of ways, males and females are going to respond the same. And when it comes to exercise, we know that the health benefits of exercise are so widespread, right? Cardiovascular fitness, brain health, helping with anxiety, depression, dementia. There are so many benefits to exercise. And so, one of the main takeaways is, if you're looking to start an exercise regime and you're a female and you're looking to improve insulin sensitivity, don't let what I've said today detract you from doing it, because honestly, it will help in the long run. We're just recognizing that women may not respond exactly the same way as men do. And we need to do the research in order to make sure that we can optimize the prescription for women in order to optimize exercise training regimes in that population. But, if you don't see the improvement in insulin sensitivity right away, it will come, and just think of all the other benefits that are coming to you because you're doing more exercise. So that would be the first thing. The second thing that I would touch upon, and this is something that we didn't really talk about, but there's been research, and this is more on the nutrition side of things, but there's been research, and I'm sure this is not going to be shocking to anyone, but that in response to a weight loss intervention, men lose more weight than women do. And I know nobody is shocked, but
People are mad.
yeah, exactly. All the women are mad. But a recent trial took overweight and obese men and women and put them on an 810 calorie diet per day. Okay, so very, very low amount of energy being consumed for an 8-week period of time. And then they looked at changes in body weight, changes in body composition, and some different health metrics. And so obviously the men were bigger than the women to begin with. And so the 810 calories for the men was a much larger energy deficit than it was for the females.
So it wasn't based on, I don't know, weight or anything like that? It was just the same intervention?
Across the board, you get 810 kcals per day, or 810 calories per day.
Which is not much.
Yeah, no. So not surprisingly, the men lost more weight. So that makes sense, right? The men lost more weight.
Okay.
But what was surprising was when they started to look at the changes in body composition. Because generally speaking, when you induce energy restriction, and so you cut your calories, the more calories you cut, the more muscle mass you lose. Because when we lose weight, we don't just lose body fat, we also lose muscle mass. And the extent of the muscle mass that you lose is directly related to how much of an energy deficit you are under.
And that's because your body needs to get energy from somewhere.
Exactly.
So it starts taking it from muscle tissue as opposed to just fat tissue.
Yeah. And generally speaking, when most people are doing that level of an energy deficit, they've cut their protein intake as well, right? And so essentially your body's like, well, I need amino acids to, make sure your liver turns over properly and continues to function properly.
Yeah, your vital functions.
Exactly. So I'm going to pull it from your muscle. So anyways, the males and the men had a greater energy deficit, yet they lost less muscle mass than the women did. And they actually lost more body fat.
Which is what the goal was.
Yeah, exactly. So the women, even though they didn't have the same extent of energy restriction, lost more muscle mass, lost less body fat, and lost less weight to begin with. So
you're not giving good news here.
No. Well, here's the silver lining. Comes back to protein. So there's lots of research that shows that higher protein diets during energy restriction are better at helping to preserve muscle mass during that weight loss. So promoting what we call high quality weight loss. So essentially the greatest amount of muscle mass retained and the greatest amount of body fat loss.
Mm.
So for women during weight loss, they should really be considering consuming a higher protein diet. I want to clarify, when we say higher protein diet, we aren't saying increase the amount of protein that you're consuming. Most people in North America are eating about 1.3 grams per kilogram body weight per day protein. So when somebody goes into a period of energy deficit, essentially what you want to do is keep your protein intake where it is and just induce your caloric restriction from cutting back on your carbs and your fats. You can still maintain a very healthy dietary pattern within the acceptable macronutrient distribution ranges by maintaining that protein intake and decreasing your carbohydrate and fat intake.
That's really important to note. Yeah.
Yeah. So women just, maintain that protein intake or bump it up slightly if you're not eating enough to begin with. And the other thing that is obviously key to preserving muscle mass is resistance training. And that's going to help you maintain that muscle mass while you lose weight. So that would be my second point.
That's a good point, because then you also burn more calories with having more lean muscle mass. It makes it more functional tissue as opposed to fat storage.
Well, and there's so many other benefits of resistance training too, right?
Yeah, fall prevention and function and quality of life, and probably pain reduction too. I think having a healthy muscle and joint system is key for maintaining and preventing muscle and joint related pain. Interesting. What do you have a third one? Do you have a third point?
Yeah. The third point I was made, we already touched on the muscle protein synthesis stuff in the older adults. But the third point I guess that I would make is for females to know that I think the future is bright when it comes to understanding the role that diet and exercise is going to play in optimizing health and performance in females. And I have to give a shout out to colleagues, young faculty members who have sort of sex-based research programs within the province who are really sort of making sure that we are doing our due diligence and ensuring that women are being represented in the research field. So, my research program is looking at sex differences in metabolism and the response to different nutrition and exercise strategies in relationship to health and performance. I have a colleague at Laurier who's looking at sex differences in appetite and how that would relate to weight management. I have another colleague at U of T who is doing work looking at how to optimize exercise's ability to improve insulin sensitivity, specifically in women. Another colleague at Waterloo with me who does sex differences in pulmonary and respiratory response to exercise. Another one at Queen's who's looking at the ability of omega-3 supplements to prevent muscle loss during bed rest and promote muscle gain during resistance training in women. And so I really think that the future is bright and that we will be able to give people a better recommendation to improve health and performance in women.
That's amazing. And it sounds, for just the list you just gave there of all your colleagues that are working hard at this, we're going to have more research coming down the pipe, more answers, more questions being asked, but more answers to those questions. But it sounds like we're also going to be getting information around different subsets of women.
Yes.
The older population, maybe around childbearing years, or even athletes, why their training might be tweaked to try to get that little bit more performance, because we know more about how women respond to certain modalities or to exercise in general, or how their body manages nutrition compared to men. And so men and women, even at the elite level, we might see improvements in performance past where we already see at the elite levels because of this science.
I completely agree, because I think female athletes are incredibly underrepresented, but we're working in this time of personalized sport nutrition. And I think as a result of that, I think the answers related to female sport nutrition might be amongst the first to sort of see significant gains, because athletes are trained to trial all their nutrition, right? And so I think if we looked to our sort of female athletes and looked at what strategies they're currently using, because they've tested and tried them out and they said, oh, okay, yeah, no, carbohydrate loading didn't work for me. But, marathon running, consuming the exogenous carbohydrates during the race did help, because that allowed me to have the fuel on board at that time. So I think we might get a better idea of what could work in females from the female athletes and make some significant progress in that area as one of the first areas that will sort of get definitive answers. And then the nice thing is that a lot of these strategies that are used by athletes trickle down into the general population, not so much to the performance benefit, but the training benefit. And that could then have an impact on health as well. So I guess there's another message.
Yeah. In your own research, what's the next hurdle or the next, low-hanging fruit? You say, I want to do this, or this is what I think I'm going to do, next year, or what's on your horizon?
Oh my goodness. So my research program has been on hold for 2 years because of COVID.
Oh no, I guess because you're exercise testing, and yeah, that's unfortunate.
Yeah, so we've got some stuff coming out in the next little while that we had done before COVID that's characterizing the normal physiological response to different modes of exercise between the sexes on post-exercise glucose control. So that stuff is kind of coming out. The next area that we're trying to look at is, okay, now that we know what the normal physiological response is, does it change in people with insulin resistance? So we're going to look at older adults. We're going to look at insulin resistant individuals. So we've got that stuff coming out with the normal physiological response. We're going to look at it in more of a pathological sense. And then we've got some training trials on the horizon looking at identifying some of the best exercise modalities to improve insulin sensitivity and whether or not the males and females with insulin resistance are responding in the same way. And I think the key thing there is that we need to include baseline insulin resistance or baseline insulin sensitivity as a covariate in our analysis so that we can see whether or not this difference has to do with baseline differences in insulin sensitivity. And then this is a funny one. This is always on my list of things to do. And it's been something that I've been talking about. And I talked about it with Dr. Marty Gabala back when I was a postdoc at Mac. And he's done so much work on sprint interval training and high intensity interval training. And he was one of the first people to recognize this sex difference in the response. And I always ask him, is it because of estrogen? And so one of the trials I want to do is I want to put a bunch of males
on estrogen
into a trial, give them estrogen. I've done it before.
Interesting.
I've done it in my PhD. Give them estrogen throughout the training and then compare the training adaptations and see whether or not the effect of the sprint interval training or HIIT training is blunted because the males were on estrogen. I think that would give us a lot of information.
What about the consideration of doing the opposite, putting women on testosterone, for example?
So in my PhD, I looked at sex differences in metabolism, obviously, and we also did this estrogen supplementation trial to males. And so essentially we gave them estrogen, and essentially during exercise, women rely to a greater extent on fat stores than males do, and males rely to a greater extent on carbohydrates. And so when we gave the males the estrogen, they then started to use more fat and less carbohydrate during that exercise bit. And so then we were always asked the question, is it the estrogen itself, or is it the fact that the estrogen lowered their testosterone? And so we kept getting asked that question. It's a lot more difficult to do a testosterone administration trial than it is estrogen for some reason.
Does that mean just getting it through the ethics review board is harder, you mean?
Yeah. To get approval for testosterone is more difficult than estrogen. But Dr. Barry Braun in the States did do the trial. And essentially, he took males and he tested them and looked at their fuel metabolism during exercise with normal testosterone levels, with testosterone levels completely ablated, so pharmacologically removed testosterone from the equation, and also at supraphysiological levels, and essentially found that the testosterone did not influence the metabolism at all. So we really do believe that it's the estrogen that's driving these effects.
Interesting.
So that's why we would want to supplement the men with estrogen.
So, because you mentioned that if they were supplemented with estrogen, the men actually used fat more as a fuel source than carbohydrate. Would that have an implication for men that want to lose fat? The new fat pill for men is estrogen?
Probably not, because the estrogen's also going to promote fat storage.
Nothing is ever that simple, right?
No.
That's really interesting. So it's time to wrap up. I've had a great time chatting with you, Michaela. Once again, I'm Dr. Andrew Miners, and I've been talking with Professor Michaela Devries-Aboud about a very interesting topic about sex differences in exercise and even nutrition. And things I took away from this is that, one, there's really not enough research out there, and the research that was done in the past doesn't tease out how men and women are different to exercise. It's also pointed out how things in nutrition and how we store fuels at our muscle level and at our cellular level, and how that can be different based on gender male or gender female. And taking that away and looking at the future of research, we're getting a lot into how we can really personalize the prescription of exercise and nutrition for performance and for health as we move forward in the future based on whether they're sex female or sex male. So thank you, Michaela. I've appreciated it. I hope you've enjoyed talking to me as well.
Thank you so much, Andrew. I had a great time.
Excellent. We'll see you later.
Take care.
That was Professor Michaela Devries-Aboud on the metabolic differences in females versus males and how exercise affects women.
She was interviewed by Dr. Andrew Miners, the Clinical and Product Director of Sports Medicine, Therapy, Rehabilitation and Fitness at Medcan.
We'll post highlights and links at eatmovethinkpodcast.com.
If you want to say hello, send us a tip or a suggestion, email us at info@eatmovethinkpodcast.com.
Eat Move Think is produced by Ghost Bureau. Senior producer is Russell Gregg. Jasmine Ratch is managing producer.
Social media and strategy support is from Chantel Gertin and Andrew Imex. Executive producer is Christopher Shulgin.
Remember to rate and subscribe to Eat Move Think on your favorite podcast platform. Follow our host, Sean Francis, on Twitter and Instagram at Sean C. Francis. That's Sean with a U, and Medcan at Medcan Live Well.
We'll be back soon with a new episode examining the latest in health and wellness.